Good morning, Peter Goertz. I'm a psychiatrist. Old state psychiatric hospitals, I want to give you a flavor for them, how they used to be. And they were hospitals where patients could stay for months. So they really had advantages if someone needed long-term treatment, like, for example, if someone was started on clozapine, they could have some time to see how the medicine worked, and they could be monitored in a hospital. Now, I did a rotation in an old state psychiatric hospital as a resident, and the experience started in the van on the way to the psychiatric hospital. We were pulling up, it was a huge place, and we were pulling up, and from a distance, we could see patients like rocking, making abnormal movements, very sad, from long-term antipsychotic medications. And the whole scenario seemed like it could have been a caricature of an old Steve Martin movie. And overall, these places were quite interesting and great places actually to learn. So I learned a lot from the patients there, and it was a place that was different from other hospitals that I'd seen. For example, they had huge metal doors to close the wards, and even I think the entrance door was like that. And if you touched the door with your hand, it would stick to the door. It was so grimy. And the work environment was less professional, it seems, than other places, even at the time. For example, one of the nursing staff ladies was wearing a t-shirt, you know, the t-shirts that say Arizona State or something like that, and it said Psychotic State, and she wore that to work. So it was a different environment from the usual work environment, and various things happened there. I was told by another resident that in the past, one of the patients had become agitated and just as needed, on an as-needed basis, gotten Haldol decanoate, which is a long-term acting medication, lasts for about a month in the system. So not really a good thing to give on an as-needed basis. So that patient had gotten that long-acting medication on an as-needed basis for agitation, reportedly. I can't vouch for that, but I was told by another resident that that had happened in the past. And a psychologist told me, this was no longer being done when I was there at that hospital, a psychologist told me that she had been around when topectomies had been done on patients. So that was a form of psychosurgery where an ice pick was stuck into the eye socket and certain tracts in the brain were severed. So it sounded quite barbaric, but it was not uncommonly done, I think maybe even until the 60s. Probably 40s, 50s, 60s, something in that range. And we were relatively independent as junior residents on that ward. So two of us in the mornings used to run a group for the patients. And you would never know what to expect. You know, everyone sat around in a circle, patients and us two residents, and people would just start talking. And one of the patients one day began the group by saying, talking at some length, I delivered a baby last night and it was stressful and it was a lot of work, and just expanded on that, which of course was not true. Everyone just sat around listening to it. I don't think even laughing. It was hard to control the impulse to laugh sometimes in that hospital because things were so bizarre sometimes. For example, things that the patient said. And Unfortunate things also happened on that ward. I remember 2 men had anal sex, and unfortunately one of them was HIV positive. Sex on a psychiatric hospital ward is not a good idea, and these tended to be chronically psychotic patients on that ward. So very difficult situation and unfortunate thing that happened. And another resident once, I don't know if it was a resident or a nurse, walked into the common room where the patients were one day, and a female patient was giving a male patient oral sex. Another patient I remember was an older, I think a lady in her 50s, who was chronically psychotic and had been in and out of a state hospital. And she knew exactly what medicine she wanted. She kept on saying to me, my medicine is L'Occitane, Artane, Benadryl. L'Occitane, Artane, Benadryl. And L'Occitane is rarely used nowadays. Artane is maybe sometimes used. Trihexyphenidyl, it's an anticholinergic medication. And Benadryl, of course, is frequently used. And L'Occitane the generic name is Loxapine. It's not used very much nowadays, but at times I think it can be used. And I have one patient on it actually, because she was not able to tolerate clozapine because of elevated liver function tests on clozapine. So she received Loxapine, and she's doing reasonably well on that. There was a forensic part to that hospital. I was not involved in that. I did not rotate on any of those wards. There was a violent ward. I also did not rotate on that. But we took the van every morning with a psychiatrist, a young psychiatrist who ran the violent ward, and he told us about his experiences. So overall, a good place to learn, sad but interesting. Thank you.